Welcome to Medicoria. Today's topic is chronic obstructive pulmonary disease, COPD. I'll be discussing the definition and the GOLD classification of COPD with a special focus on demystifying the pertinent lung volumes. GOLD is the Global Initiative for Chronic Obstructive Lung Disease. According to GOLD, before one considers diagnosing a patient with COPD, they should have evidence for the condition from their clinical database, that is to say from the history and from the physical examination of the patient. Thereafter, the diagnosis of COPD is confirmed on spirometry. COPD is defined as a ratio of forced expiratory volume in 1 second to forced vital capacity of less than 0.7 or 70% if expressed as a percentage. Now let's demystify this ratio, starting with FVC, forced vital capacity. Forced vital capacity is the volume of air that one can exhale with maximal effort after maximal inspiration. In other words, you're going to instruct the patient to breathe in as deeply as they can, and then you measure the volume of air that they can forcefully exhale. Technically speaking, forced vital capacity is simply a variant of vital capacity, which most of us are familiar with. Vital capacity can be measured as inspired vital capacity, forced vital capacity, or slow vital capacity, depending on the maneuver involved. Forced vital capacity is the best measure in this case because it gives a better reflection of vital capacity in a patient with unobstructed airway. Otherwise, a normal person is expected to have similar measurements from the different maneuvers. The forced expiratory volume in 1 second is the volume of air that one can exhale with maximal effort in the first second following maximal inhalation. In other words, this is the portion of forced vital capacity that comes out in the first 1 second of expiration. A normal person is able to forcefully expire more than 70% of the forced vital capacity in the first 1 second of expiration, whereas someone with a significantly obstructed airway is only able to expire less than 70% of the vital capacity in the first 1 second of expiration. Therefore, 70% is going to be our cutoff for airway obstruction. Someone with an FEV1 to FVC ratio less than 70% is considered to be having significant airway obstruction, meeting the criteria for COPD. Now let's flip over and look at the GOLD classification of COPD. I'll start off with a few basic facts. In the olden days, COPD was considered a condition of irreversible airway obstruction. But this is rather a pessimistic way of looking at things. Today we prefer to say COPD is a condition of partially reversible airway obstruction. Indeed, patients with COPD show partial response to bronchodilation. This new perspective forms the very basis of the GOLD classification of COPD. A patient whose airway obstruction can be reversed by bronchodilators to as close as normal is considered to be having mild COPD, whereas someone whose airway obstruction is less reversible is considered to be having severe COPD, as we shall see shortly. This classification is therefore based on the post-bronchodilator forced expiratory volume in 1 second as a percentage of the expected value. Now, most of the literature leaves this statement as abstract as it is here, and the so-called expected value remains a mystery to many. But the expected value is the forced expiratory volume in 1 second that individual would be expected to have if they had a normal airway. This value is calculated based on the patient's age, height, sex, and race. In other words, this percentage is a measure of the extent to which the airway obstruction can be relieved towards the normal value. According to GOLD, COPD is classified into 4 stages. The first stage is mild COPD, also known as stage 1 COPD. This is defined as a post-bronchodilator forced expiratory volume in 1 second of greater than or equal to 80% of the expected value. The next is moderate COPD or stage 2 of COPD, which is defined as a post-bronchodilator forced expiratory volume in 1 second of 50 to 79% of the expected value if this patient had a normal airway. The third is severe COPD or stage 3 COPD, which is defined as a post-bronchodilator forced expiratory volume in 1 second of 30 to 49% of the expected value. And lastly, very severe COPD or stage 4 COPD is defined as a post-bronchodilator forced expiratory volume in 1 second of less than 30% of the expected value. As a bonus, let me take you through an overview of the management of the different stages of COPD. The approach to the management of COPD is a step ladder approach, where the management is stepped up as the patient goes higher in the stages of COPD. One thing I need us to observe here is that all the forms of management from a milder stage of COPD are carried forward to a higher stage of COPD with addition of further approaches to management, as we shall see shortly. Mild COPD is managed with short-acting bronchodilators as required. Stage 2 of COPD is managed with short-acting bronchodilators as required, plus long-acting bronchodilators, as well as cardiopulmonary rehabilitation. Cardiopulmonary rehabilitation involves things like cessation of smoking, social support to the family, respiratory physiotherapy, among other things. Stage 3 of COPD is managed with short-acting bronchodilators as required, long-acting bronchodilators, cardiopulmonary rehabilitation, inhaled glucocorticoids if there are repeated exacerbations of COPD. And lastly, stage 4 of COPD is managed again with short-acting bronchodilators as required, long-acting bronchodilators, cardiopulmonary rehabilitation, inhaled glucocorticoids if there are repeated exacerbations, long-term oxygen therapy if the patient meets the criteria, and surgical approaches also if the patient meets the criteria, for example, lung volume reduction surgery, lung transplants, among other surgeries. Like already mentioned, this is simply an overview of the management, but take it upon yourself to go and review the pharmacology of short-acting bronchodilators, long-acting bronchodilators, and the other pharmacologic options to the management of COPD. Otherwise, that is it for today's video on COPD. Thank you so much for watching till the end. If you enjoyed, don't forget to smash that like button and to give us feedback in the comment box below. Do subscribe to the channel and turn on your notifications so that you do not miss out on similar videos in the future. See you next time.